How to do a gram stain. The gram stain technique is used to classify bacteria as gram-positive or gram-negative based on the differences in their cell wall structure. This is done because you want to tell the difference between a gram-positive and gram-negative to make sure that doctors are able to prescribe the right antibiotics. The gram stains help with knowing the shape or cell morphology and also be able to tell the arrangement they have, whether it's chains, clusters, or pairs. For a gram positive, they have thick peptoglycan layers and retain crystal violet dye. A gram positive bacteria, the alcohol will dehydrate the peptoglycan so that the crystals will not be able to leave. A gram-negative bacteria will have thinner peptoglycan layers, and the peptoglycan will leave holes in this and have the saffron stain the cells. The outer membrane of a gram-negative bacteria will be made up of lipopolysaccharide. For gram-negative cells, they have low susceptibility to penicillin, whereas gram-positive will have a high sensitivity to penicillin. To begin a gram stain, you must wash your hands and put on your PPE. This will consist of an apron, gloves, face mask, and finally your goggles. Next, you're going to want to clean your work surface. This will be with a disinfectant of your choice or a disinfectant wipe with a paper towel. Next, you're going to want to set up your contamination station. This will be a sealable bag, such as this one, with 50% of it filled up with bleach. You'll also take a cup such as this one, and fill it up with 1/4 of isopropyl alcohol that is either 70% or higher, such as this one. Next, you are going to take a slide, such as this one, and a permanent marker and be able to make a circle in the center of the slide. In most cases, you will not know which bacteria you are testing for, therefore, you will not be writing the name of the bacteria on the slide. So first you're going to be able to take your bacteria tube, such as this one, and you're going to take a tea light, such as this, and you're going to put um the you're going to take off the cap and you're going to go ahead and turn it on above the tea light, and this is to make sure that you are not contaminating or getting rid of any back microbes that are on the surface of the tube that you are testing. Next, you are going to take an inoculated loop such as this one, and you're going to be placing it inside the cup with the isopropyl alcohol. Taking the tea light and placing it above the inoculated loop above the tea light to make sure that you're burning out the alcohol and making sure there's no contamination. Once this is done, you are going to make sure that all the isopropyl alcohol is off of this, and you're going to insert the inoculated loop inside of the test tube, and you're going to mix it to make sure that all the microbes are on the inoculated loop. Once this is done, you're going to go ahead and take the inoculated loop, put it on the slide, smear it inside the center of the circle of the slide so that you are making sure that the bacteria culture is getting on the center of the circle. Once this is done, you're going to go ahead and put your inoculated loop inside of the cup with the isopropyl alcohol, and you're going to wait for the slide to dry. Once this is dry, you will hold the slide at the edge and place it over the flame of the tea light candle. You want to make sure that it is not too close because it will denature the the bacteria on here, and it will also um but you also want to make sure that it is close enough where it will adhere, the bacteria will adhere to the slide. Once this is done, you will take the slide and place it in the staining tray, such as this one. Once the slide is inside, you will go ahead and take your crystal violet and drop 2 drops of it in the center of the circle. Once this is done, you will let it stay on the slide for 60 seconds and raise the slide. Rinse the slide with tap water, holding at an angle, such as so that the water can just drain off. Once the water is clear, you are going to now place the slide back into the tray and add PVP iodine in the center of the smear to make sure that the stain is on there for at least 1 minute. Once this is done, you will then rinse the slide with tap water again, making sure that the water is going into the sink. Once this is completed, you will take the slide and put it back on the tray, adding some decolorizer. Once this is completed, you will let the stain remain for 30 seconds, and you will do the same process of getting the slide and let it drip under water. And once it's done, you will put it back into the tray and add some saffron into the center of the circle. You will then allow the stain to absorb for 30 seconds and then rinse the slide one more time with tap water. Once this is done, you are seeing that the water is drained from the slide. You will then take a paper towel, fold it up, and put the slide on top so that it can dry. Once it is there and it is drying, and it is completely dry, you will then take it and put it under a microscope. You're going to go ahead and put the slide on in the center of the microscope, and you are going to turn it on. Once this is completed, you will start off with this 4x objective, working your way all the way up into the 100x. And then when you are finally there, you will go to the oil immersion lens. Once this immersion oil lens is there, you are going to go ahead and lower your stage, put 1 drop of oil immersion oil in the center of the circle, and then you are going to go ahead and raise your stage to be able to see the, the slide. And once this is done, then you will be able to use the fine focus knob to be able to sharpen the image so that you can see it. You want to make sure that you are not submerging your lens inside of the oil. And then once this is completed, you will see if the bacteria is gram negative, it will be pink, and if it is gram positive, it will be purple. The reason why it is so important to make sure that there is no cross-contamination is to be able to view the correct bacteria. This is so doctors can help prescribe the correct antibiotics to directly affect the bacteria that they are trying to get rid of. It can also alter results, causing the wrong antibiotic to be given if you are not addressing the correct bacteria. The first mistake that I made personally was I took the inoculated loop um, and placed it way too close to the fire. This is plastic, so it caused the inoculated loop to burn, and I had to start all over. The second mistake that can also happen is that the slide can either be too close to the fire, causing the bacteria to denature, or it could be placed too far, making sure that the bacteria is not adhering to the slide and having the bacteria go into the sink drain.